Hello everyone, I am Dr. Irfan and I'm really excited to have you join me in this new YouTube series where we will be diving deep into the world of veterinary clinical medicine. This course is designed to help you understand the real life application of veterinary knowledge, how we examine, diagnose, and treat animals in clinical settings. Okay, so whether you are a student or a young vet or someone who is related to this veterinary profession, so you are in the right place. Okay, so this is the brief introduction regarding this lecture series. So we will be mainly dealing with the veterinary clinical medicine, and after watching the recorded lectures, I am sure that you will get a handy grip on the handling of various clinical cases, understand the actual what is veterinary medicine, because from the veterinary graduation हमें जो veterinary clinical medicine पढ़ाई जाती है उसमें हमें वो फील नहीं आता है, and in the field we face a lot of problems, so mostly in the small animal practice. So I think and I believe that these lectures will definitely help you, and I will be also discussing some with each, whether we will be starting some, for example we are discussing the diabetes or diabetes mellitus in canines and felines. I will be, after the end of the lecture, I will be discussing the published case reports also. Okay, so this course will be also beneficial for the students doctors who are preparing for PG entrance exams like ARS. Some are preparing for net in as you know that ARS notification has been advertised, so this course will definitely help them, and also for the net aspirants preparing for the net mainly in veterinary clinical medicine and other exams like NAVLE, and also for the veterinary graduates. Okay, so without wasting more time, let us start our first lecture. So we will be taking up with endocrinology. Okay, you know that this endocrinology in small animal practice, it's very much advanced. Okay, so हमें जो हमारी ग्रेजुएशन में पढ़ा जाता है, but it is beyond that. Okay, so what are the different endocrinological conditions in dogs and cats, और हमें ये cases जो भी small animal practice करता है तो उनको ये cases मिलते हैं. In order to give a detailed discussion and detailed information about these conditions, so we will be first dealing with this endocrinology part. Okay, so in the endocrinology part I will be starting with, for your understanding, I will be starting with hypothyroidism. Okay, I will be starting with hypothyroidism. Hypoparathyroidism. Hypoparathyroidism. In order to understand this hypoparathyroidism, what is pathophysiology, what are its different approaches that we have to discuss in the hypoparathyroidism. You know that in dogs and cats, we have two parathyroid glands. Okay, these are parathyroid glands. So what is the first of all, we will discuss this a bit about the physiology, normal physiology. After that, when you know the normal, you will be definitely, you will come to know what is the abnormal in this. Okay, in the physiology, this parathyroid gland is important for it has a different types of cells called chief cells, and these chief cells are responsible for the secretion of parathormone. Okay, parathormone. So this PTH, it acts on three organs of the body. Okay, first of all, it will act on the bones. Secondly, it will act on the kidney, and indirectly it acts on the gut. Okay, this is the normal physiology. Now, normally these parathyroid glands, they secrete the parathormone. It, when it acts on the bones, it acts on the osteoclasts of these bones, and these, what these osteoclasts do, they help in the reabsorption of calcium. Okay, क्या करते हैं ये reabsorption of calcium from bone into the blood. Okay, when this parathormone will act on the osteoclasts of the bone, and these osteoclasts, they cause the reabsorption of calcium from bone into the blood. Okay, this is the normal. Second, this PTH, what it does in kidney, PTH has two roles. Okay, one is in kidney, PTH helps to convert 25 hydroxycholecalciferol into 125 dihydroxycholecalciferol, that's active vitamin D. Means this PTH first function is it will lead to the conversion of 25 hydroxycholecalciferol into the 125 dihydroxycholecalciferol. Okay, this is the active form of vitamin D. So when this vitamin D is synthesized in the kidneys, this vitamin D, what it does, it will go to the it will, what it does, it will help in the absorption of calcium from gut. Okay, means this PTH, it forms the vitamin D. Vitamin D, it helps in the absorption of calcium from this gut. Okay, and secondly, PTH directly helps in the absorption of calcium from proximal convoluted tubule. So what it does, PTH, it goes to the bone, modulates the function of osteoclasts that cause the reabsorption of calcium from the bone into the blood, means maintaining calcium homeostasis. Okay, secondly, it will go to the kidney, and in kidneys it causes the conversion of 25 hydroxycholecalciferol to 125 dihydroxycholecalciferol, and also in PTH cause the absorption of calcium, means maintaining calcium homeostasis. And this 25 hydroxycholecalciferol, what is vitamin D, it will there are some proteins in this gut, and it modulates the function of these proteins, and these proteins are important for absorption of calcium from the gut. So this is the normal physiology of what we call as PTH. Okay, now now what is more important is the what actually is the what causes the hypoparathyroidism in case of the canines and felines. Now this was the physiology part, means this parathormone, these parathyroid glands are important for maintaining the calcium homeostasis in case of the canines and felines. Okay, now whenever there is any sort of whenever and there is any sort of destruction to these parathyroid glands, okay, means there is any sort of destruction to these parathyroid glands, what will happen? There will be decreased secretion of PTH. Okay, or if these parathyroid glands are absent, that will also lead to the decreased or absence of PTH hormone. Now what are the conditions that lead to the destruction of this parathyroid gland? Suppose there is a dog or cat, okay, it is suffering from thyroid adenoma, okay, or there is dog suffering from lymphocytic plasmacytic thyroiditis. Okay, so in these situations, what is the this practice followed? It is to go for the surgical removal of thyroid gland. Okay, surgical removal of thyroid gland. So what happens that when the surgeon is performing the thyroidectomy, okay, for example, the surgeon is performing the thyroidectomy, means it is removing these thyroid glands from the patient. So accidentally, because these are in close proximity, accidentally parathyroid glands are either parathyroid glands are either destroyed or removed. Means this is the what we call as destruction. Means during the thyroidectomy or any sort of neck surgery, whenever these parathyroid glands are also severed or injured, we can say, so at that time there will be this there will be destruction of these parathyroid glands, and that will to the decreased PTH or absence of PTH. Or if there is parathyroid adenoma, at that time it is advised to go for parathyroidectomy. So this will result in the decreased PTH. Means these are all iatrogenic causes. Okay, so you should remember iatrogenic cause include during the thyroidectomy, if parathyroid glands are accidentally injured or severed or removed, so that will lead to the hypoparathyroidism. Or if there is parathyroidectomy, so in which cases the this hypoparathyroidism can occur iatrogenic, like there is thyroid adenoma, there is plasmacytic, lymphocytic, this thyroiditis. So because at a time there is surgical removal of thyroid gland. Okay, so the second cause could be this was the first I can call it iatrogenic. In iatrogenic we have thyroidectomy, second is parathyroidectomy, and third is if there is autoimmune, autoimmune destruction of parathyroid glands. Okay, now you know that in dogs one of the autoimmune condition is found that are already discussed, lymphocytic plasmacytic thyroiditis is one condition. Okay, second one is that has been commonly found is autoimmune polyglandular syndrome type 1. Okay, APGS1. So this what happens in the autoimmune polyglandular type 1, there is the means in this condition, in this autoimmune condition, there is production of autoantibodies against the chief cells of parathyroid gland, that leads to the destruction of the chief cells and finally decrease PTH secretion. Okay, hope you are getting this. So what are the different causes of this APGS? So यहाँ पे it is out of the domain, but remember there is the point mutation of AIREG. Okay, so there is a special type of gene. Whenever there is point mutation of this gene, it will lead to the APGS type 1, and in the APGS type 1 there is production of autoantibodies that leads to destruction of these chief cells and finally hypoparathyroidism. Okay, so in in humans, in people, you can see this APGS type 1 is characterized by three conditions. Okay, not commonly seen in case of the dogs and cats, but sometimes in dogs you can see this, but mostly in case of the people. Okay, whenever there is APGS type 1, there will be mucocutaneous candidiasis. Okay, second, there will be adrenal failure and hypoparathyroidism. Means for APGS you have to remember three things. APGS is characterized by mucocutaneous candidiasis. Okay, there is adrenal failure and hypoparathyroidism, and when there is adrenal failure, finally the patient develops what we call as Addison's disease, जो हम आगे देखेंगे. Okay, so this is the autoimmune destruction of PGS, and hope आपको ये सारा जो etiology में समझा रहा हूँ वो सबसे पहले destruction of these parathyroid glands और there will be congenital anomaly. Okay, तो इस पे एक केस रिपोर्ट भी है congenital anomaly पे, वो हम डिस्कस करेंगे. And what are the different conditions that lead to the destruction? I told you it could be thyroidectomy, parathyroidectomy. What are the different conditions in which there will be accidental removal of parathyroid gland, thyroid adenoma, lymphocytic parasitic thyroiditis, and this wholly lead to the hypoparathyroidism and autoimmune destruction. We have APGS type 1. Okay, so in nutshell, whenever these conditions will be present, there will be disturbance. There will be disturbance in PTH. Means parath hormone जो है PTH hormone, it will be decreased. Secretion will be decreased. That will definitely lead to the disturbance in कैल्शियम होम्योस्टेसिस, जो हम आगे देखेंगे. Okay, now now the third etiology is if there is absence of parathyroid gland. Okay, means normally there is a type of syndrome called Diagnostic syndrome. Okay, Diagnostic syndrome. In Diagnostic syndrome, what happens that third and fourth pharyngeal pouch fails to form. Okay, इसमें क्या होता है कि what happens that this third and fourth pharyngeal pouch during these are the primordia for these parathyroid glands, they fail to form, and there is means there is absence of parathyroid gland. Okay, so remember, whenever there is Diagnostic syndrome, this Diagnostic syndrome is characterized by 5 conditions. Okay, there are 5 conditions that characterize this Diagnostic syndrome. So you have to remember them. There is a mnemonic catch. There is a mnemonic for this. So first of all, there will be cardiac defects. Okay, second, anomalous face, there will be face deformity. Third, thymic hypoplasia. Cleft plate and hypoparathyroidism. So this you have to remember that there will be such conditions. Okay, so this was the etiology. Okay, so remember, this is the etiology and this is the physiology. Now we will discuss the pathophysiology of hypoparathyroidism. देखो, जब आप मेडिसिन पढ़ते हैं तो मेडिसिन ऐसे ही पढ़ा जाता है जैसे हम अभी पढ़ा रहे हैं आपको. मेनली इन केस ऑफ द इन आवर यूजी व्हाट वी डू, etiology याद रखते थे, देन this dash other things like you have pathogenesis, you have what is this clinical sign. No, whenever you are going to discuss any sort of condition in veterinary medicine, read it like this: physiology, then this etiology, how to diagnose this etiology, then pathophysiology, and it will stuck in your mind. Okay, ये आपको पूरा ज़िंदगी याद रहेगा. And when I will be dealing with the complications, you will see how these complications are interrelated with this. So इसलिए मैं कह रहा हूँ, that's why I'm telling you that this course will be entirely different. So at the end you will trust me, just have a belief on me. At the end you will definitely feel yourself कि हाँ कुछ मतलब we are learning something good. Okay, so pathophysiology. Pathophysiology of hypoparathyroidism. Now, I told you earlier that these chief cells in the parathyroid glands, they secrete PTH. Okay, this PTH, it will act on the bones. Okay, this PTH, it will act on the kidney and indirectly to the gut. In bones, I told you, already discussed, in bones it stimulates the activity of osteoclasts, and these osteoclasts cause the reabsorption of calcium, you all know that, from bone to blood. Okay, means maintaining the normal calcium eucalcemia or normal calcium hemostasis. So whenever there is pathophysiology, whenever there is decreased excretion of this parathormone, so because of the different conditions that I already discussed in the etiology, so finally there will be when there will be decreased excretion of PTH, there will be decreased activation of these osteoclasts, and they will lead to the decreased what we call as reabsorption of calcium from the bones into the blood, and finally there will be decreased calcium in blood. Okay, there will be hypocalcemia. नॉर्मल, ये तो खुद ही समझ में आएगा. Second, what happens that when PTH will act on the kidneys, when PTH will be decreased, it will cause the decreased conversion of or decreased synthesis of vitamin D, vitamin D3, and there will be also decreased reabsorption of calcium from PCD. So this vitamin D3, when it will be decreased, so it will cause the decreased absorption of calcium from gut. So in nutshell there will be hypocalcemia. Okay, so one more thing. So what we have to remember, few things. In hypoparathyroidism, remember, there is always hypocalcemia. Okay, and now second thing is, in hypoparathyroidism, this parathormone, remember, this PTH is also important for excretion of phosphates from kidneys to urine, means maintaining the normal phosphate level in the blood. Okay, so this is the normal. Now in pathophysiology, what happens that when there is decreased PTH in the kidneys, it will cause the decreased this excretion of phosphates in urine. Okay, means what will happen? There will be hyperphosphatemia. Okay, these two things you have to remember, that hypoparathyroidism is characterized by hypocalcemia, hyperphosphatemia, because when we will be discussing the diagnosis of this hypoparathyroidism, you have a case, तो आपको लगता है कि फ्रॉम दी क्लिनिकल साइंस जो हम अभी देखेंगे, दिस इज अ केस ऑफ hypoparathyroidism. So you will tell the owner to go for a serum profiling. Okay, उसमें आप क्या देखोगे? कैल्शियम लेवल एंड फॉस्फेट लेवल एंड पीटीएच लेवल. When the calcium level is decreased, phosphate level is increased, and pTH level is decreased, so you will see that you will diagnose it as a case of hypoparathyroidism. Okay. So this is the pathophysiology of hypoparathyroidism. So this is the pathophysiology. Okay, now, so what you got? In hypoparathyroidism, it is there will be hypocalcemia, there will be hyperphosphatemia, and there will be decreased pTH. Now, what are the complications of hypoparathyroidism? See, normally whenever there is decreased pTH, okay, the bone, it will go to the, there will be decreased sensitization of this bone, and what will happen? There will be decreased calcium. Okay, there is hypocalcemia and increased phosphate. Okay, this is when it acts on the bone. Similarly, pTH to the kidneys, there will be decreased this vitamin D absorption, there will be decreased vitamin D synthesis, and finally there will be decreased absorption of calcium from gut. Finally this. Okay, so this is the what I told you in the this pathophysiology. Now, in order to understand the complications, the first complication is that is a neuron. Okay. In the neuron, you all know that we will discuss the when we read the in our EUG courses फिजियोलॉजी में जब हम पढ़ते हैं न्यूरॉन कंडक्शन, तो इसमें थोड़ा सा मैं आपको थोड़ा सा यहाँ पे एड ऑन करता हूँ. So what happens that for neuroconduction there is always influx of sodium, and this sodium is important for neurotransmission. Okay, whenever there is neurotransmission at the synapses, there is release of neurotransmitters. Okay, and in order to regulate these influx of sodium, calcium is important, because calcium is important. Why? Because if there is continued influx of sodium, there will be continued release of what we call as neurons, and that will lead to the different conditions. But this calcium, what happens that this calcium blocks these sodium channels, and in a sense causes the what we call as it regulates this nerve conduction in the neurons. Now, when the calcium when there is hypoparathyroidism, there will be decreased hypoparathyroidism, there will be decreased calcium in the blood. So there will be less calcium present to modulate the function of these neurotransmitters. Okay, these receptors or these conducting channels. Okay, means there will be continuous neurotransmission that will lead to there will be increased, we can say that, increased depolarization of these neurons, and there will be increased action potential across the neurons, and that will lead to the sustained release of neurotransmitters. And whenever there is sustained release of neurotransmitters, that leads to the condition called what we know as tetany. So remember, there is hypoparathyroidism, there is decreased calcium in the blood, and in the neuromuscular site, what happens that this calcium is important for regulation of this neurotransmitter, these conducting channels, sodium conducting channels. And when there is decreased calcium, क्या होगा कि ये वाला इसको ब्लॉक नहीं करेगा, means there is one wave of depolarization, and then calcium binds these, then there is again repolarization, then second wave of depolarization, means that's the normal. But what happens that when there will be hypocalcemia, there will be decreased wave of repolarization, so there will be sustained release of neurotransmitters that will lead to the tetany. So this is the first clinical sign that you will see in every case of hypoparathyroidism. Remember, tetany. Okay, now here I will discuss a few things regarding tetany. This tetany, you will always, these tetanic seizures, we can say, you will always see them whenever a dog or cat is showing muscular activity like playing, jumping, okay, or there is any sort of stress. Okay, so if you see a dog is at rest, there will be less chances of tetany. Although the dog or cat is suffering from hypoparathyroidism, but it is at rest, so there will be less chance of tetanic seizures. So whenever the dog is showing the muscular activity, so you will always see these tetanic seizures. Okay, so this thing differentially diagnose it from epileptic seizures. Why? Because epileptic seizures they can be seen in dogs and cats whether they are at rest or in motion. Okay, and these tetanic seizures, they always start from face towards the hind quarters. So these things you have to remember. Okay, also one more thing is that this, whenever What are the two things that enhance or modulate the tetanic seizures? One is whether there is muscular activity or stress. Second one is if the dog is panting. Why there will be increase in modulation of tetanic seizures during panting? Because panting leads to the respiratory alkalosis. So whenever there is alkalosis, there will be decreased ionized calcium. Okay, so that will further modulate these tetanic seizures. Okay, so these things you have to remember. One is one of the complication. This is the pathophysiology, how it occurs, these tetanic seizures, and how to diagnose differentiate between these tetanic seizures and epileptic seizures, and how this panting it modulates these tetanic seizures. Okay. Second one is now. Second one is this was the first one was this neuromuscular. Okay. Second one complication is cardiovascular. Okay. In the cardiovascular, what happens that in the cardiovascular, remember that QT interval is very important for examination point of view, because this is the ECG finding in hypoparathyroidism is inversely proportional to the calcium concentration. Whenever there is decreased calcium, there will be prolonged QT interval. So what will be the ECG finding? ECG finding in this hypoparathyroidism, it would be, remember, it would be prolonged QT interval. Okay, so this is the these are the cardiovascular signs. And also remember that these, you know, that for myocardial contractility you need calcium. These cardiomyocytes need calcium. And during your this your UG courses, you might have read this phases. Okay, this is phase 0, phase 1, phase 2, phase 3, and phase 4, isoelectric line, phase 4. So during the phase 2, what happens that there is this influx of calcium, and what we call as phase 2 represents mainly this ventricular depolarization. Okay, so for that, when जब हम ECG पढ़ेंगे, I will make you understand what are these phases and all that. So this calcium is also important for, in nutshell you can remember, calcium is important for action potential in heart. Okay, so whenever there is decreased calcium in hypoparathyroidism, there will be cardiovascular changes also. There will be this ECG, you will see increased QT interval, prolonged QT interval, and finally there will be arrhythmias. Okay, so this in prolonged QT interval, it leads to the Torsades de Pointes. It's a type of arrhythmia, and finally death. So this is the cardiovascular changes in this hypoparathyroidism. Okay, so there are few more complications, like you can see there are ocular changes. So one of the ocular changes, you can see the cataracts. So there are some cases of hypoparathyroidism, you see cataracts. Okay, whenever there is chronic hypocalcemia, there are cataracts. Okay, so this is also whenever there you can see ocular change, what? Cataracts. So there are also cardiovascular cytology, there are GI signs also. GI signs, normally you don't see them, but some of the cases are reported there will be omission. So mainly what you have to remember, there will be tetanic seizures, okay, there will be cardiovascular change, okay, there will be in some cases cataracts, okay. So these things you have to remember. So these are the complications. For I will summarize some of the clinical signs for you. Whenever a case comes to you, see whether there is tetany, okay, whether there is tetanic seizures are there, whether there is any sort of respiratory arrest, okay, or there is like this cataracts are there, and in some cases you see hyperthermia also, but mainly tetany for clinical diagnosis. So these are the clinical signs. Now what you have to remember that normally clinical signs appear when total calcium is below 1.5 millimoles per liter, okay, and ionized calcium is less than 0.8 millimoles per liter, okay. So this you have to remember. So these were the complications of hypoparathyroidism. You can also, in a case report, there was the myocardial failure also. So I have told you how this myocardial failure occurs, because when there is hypocalcemia, there will be decreased myocardial contractility, and this will lead to the decreased this action potential caused arrhythmia like torsity pointies. So these are the complications. Now most important part is diagnosis. For diagnosis, remember, whenever a patient comes to you, patient A means there is patient X comes to you, how will you evaluate this case? First of all, you will take the history, okay. In history you will see whether there are any tetanic seizures, okay, this you will see, okay. And other clinical examinations, you will thoroughly evaluate the animal, like what its temperature, what are its heart rates, respiratory rates, and other things. And after that, and also in advanced, if you are in the advanced clinic, go for ECG. So what will happen that after that, taking the history, you will obtain the serum calcium and phosphate, okay. Now if you see that there is decreased serum calcium and increased phosphate, what you will do, you obtain the serum calcium phosphorus, there is decreased serum calcium and increased phosphate, then obtain PTH, okay. When you will obtain the PTH, if PTH is decreased, okay, means it is hypoparathyroidism. But when you will diagnose it as a hypoparathyroidism, see if there is recent neck surgery. If yes, means it is iatrogenic hypoparathyroidism. Okay. If no, then if you are in an advanced lab, go for genetic testing whether it is a case of autoimmune destruction. Okay. Now, in some cases, you will see increased PTH. Okay, despite there is decreased calcium and increased phosphate, you will see increased PTH. What is it? It is called pseudo hypoparathyroidism. What is pseudo hypoparathyroidism? Means the receptors on the organs, like on the kidney, like on the bones, they are not responding. Means PTH secretion is good, it is normal. Okay, but the receptors that are present on the kidneys or bones, that are not responding to this PTH, and when it is not responding to this PTH, there will be decreased calcium. So this is pseudo hypoparathyroidism. Okay, so this you have to remember. Okay, so this is how you go for diagnosis. Remember this, it will help you in labs. For examination point of view, remember functional hypoparathyroidism. Means there is, whenever there is hypomagnesemia, there will be in this functional hypoparathyroidism. Functional hypoparathyroidism, when there is hypomagnesemia, it impairs the function of PTH. Okay, so mainly hypomagnesemia is the cause. Now this is regarding the diagnosis. So remember how we'll reach the diagnosis, and now the important part is treatment. Okay, हम इसको ट्रीटमेंट ऑफ हाइपोपैराथायरॉयडिज्म नहीं कहेंगे, इट इज एक्चुअली ट्रीटमेंट ऑफ हाइपोकैल्सीमिया. No. Whenever there is a case of hypothyroidism, you have diagnosed it and there is hypocalcemia. Whenever there is what we call as there is acute hypocalcemia, what happens in the acute hypocalcemia? You will see that for acute hypocalcemic cases, or in whatever the case you will be getting, you will see there is drastic decrease in this calcium. So the first therapy will be 10% calcium gluconate. Remember this, 10%. Okay, 10% calcium gluconate. Okay, remember this 10% calcium gluconate, it contains 9.3 mg 9.3 mg of elemental calcium. Okay, it contains 9.3 elemental calcium per ml, means 10% of calcium gluconate. How much calcium it contains? 9.3 mg of elemental calcium per ml. Okay, so this you have to give at the rate of 0.5 ml to 1.5 ml per kg body weight. Okay, this you have to give at the rate of 0.5 to 1.5 ml per kg body weight. So while giving this 10% calcium gluconate at the rate of 0.5 to 1.5 ml per kg body weight, always remember C for the ECG changes. If there is prolonged QT interval after this infusion of this 10% calcium gluconate, stop it.